If I could talk to just any physical therapist anywhere, I would love them to know that every person they see has a pelvis, and they should be asking them questions about how are you doing with continence and comfort, and does sex hurt, because it shouldn't, and you should never, ever, ever leak. And there's hope for things and help for if you are. I would like to see people that have pelvic pain when they first say that they have it. I would love to be able to get in the way of that length of time between when you have a problem and when you finally get to care for it. And we know that women in particular, and I am sure guys too, are suffering through pain for much longer than they need to, and they almost are waiting for years before they get to good care. I would like to get acute pelvic pain instead of chronic pelvic pain. And the average length of time someone that comes to me has hurt is about 12 years, which I think is, 11 years and 9 months longer than they should. So I'd like to speed that process up. Pelvic pain is caused by so many different things. It can be accidents. It can be, like when you're hiking and you fall and you land on a rock and you get a spasm in your pelvic floor and it just doesn't go away. If that was your foot, you'd stand on it. But a lot of times when you're something in the testicles or penis or vagina hurt, you just stay off it, unweight it, and don't use it. And I think that kind of prolongs it. But there can also be skin issues that need good dermatological attention. There can be STDs can cause some pelvic pain. So it's not all musculoskeletal, and there are some things that need medical assistance, but it's also not all medical, and some things are musculoskeletal. So it just takes a team to figure it out. The problems with getting care, it's not just embarrassing to say that your vagina or your testicle hurts. It's that sometimes you're told that's normal and there's nothing that can be done for it. So we have an issue of people that need help and don't know where to go, but also think that it's normal to hurt, or think that it's normal for incontinence, or their families or their communities are telling them that there's nothing that can be done. So it's a multi-tiered problem for access to care.